Welcome to the training video on the OHI OneScan system. At the end of this video, you will be able to scan patients for custom orthotics using an iPad and the structural sensor. At this stage, you should have the scanning system set up and ready to go. Ideally, the patient information is entered into the Fusiform app either through the iPad or using your office computer prior to the patient visit. There are a few simple steps in getting an accurate 3D scan. When it comes to scanning for a custom orthotic, the aim is to place the foot in a subtalar neutral position. This position can be achieved by having the patient in various standing or kneeling positions. We will first demonstrate scanning techniques while the patient is in the prone position. We will also demonstrate correct foot position when working with patients in supine position and continue our demonstration to show the correct position when working in the absence of a bed and using a chair instead. Begin with the patient laying on their stomach. Make sure the heel of the foot being worked on is on a transverse plane. Visually, the calcaneus should be parallel to the transverse plane, making sure the subtalar joint is in a neutral position by checking the medial and lateral heads of the talus. Pronate the area under the 4th and 5th met heads by placing pressure in that area. Now we have a perfect subtalar position. At this point, we need the patient to keep this position while we scan, which will take only a few seconds. It is helpful to have the iPad ready for the scan ahead of time. From the patient screen, choose Add Media and tab Take Scan. Ideally, the scanner should be approximately 2 feet from the patient. It is recommended to test the settings for your exam room ahead of time to save time during actual patient exams. For this demonstration, we will set the width at 47, the height at 30, and the depth at 36. These settings are adjustable and are dependent on how far the scanner is held from the patient. Once the foot is inside the white box and highlighted in red, you're ready to scan. Press on Scan button and slowly move the scanner around the subject, making sure to capture the entire plantar surface of the foot and a bit of the medial and lateral sides. Continue moving the scanner around the foot until the entire surface is captured in white. Tap the Done button. The final scan should show the entire bottom of the foot. Review the scan and rotate the foot to make sure the entire surface is captured. Don't be too concerned if some sections of the side are not completely white. At this point, you can choose to save the scan or discard the scan to start over again. If you're happy with the scan, tap Save button and indicate whether it is the right or the left foot. Continue with the other foot. Supine position. The patient should be laying flat on their back with their feet extended beyond the edge of the bed to avoid interference during scanning. Using the same technique to make sure the foot is positioned in a subtalar neutral position, begin scanning the foot. Chair position. Using a solid chair, get the patient to kneel facing the back and using the backrest as support. Position the foot so that the medial and lateral heads of the talus are equal. Push on the 4th and 5th met heads. Check to make sure the heel is in transverse plane. While the patient is keeping the foot as still as possible, begin scanning. Don't forget to repeat for the other foot. We hope you found this video helpful.
Perfect.